I was interested in science from a young age. Through my education, became really focused on biomedical research in particular. And there was maybe a scenario where perhaps I would have been a scientist primarily in my career. But what I realized at some point was that the science was interesting, but I wanted to be studying something that had direct relevance to patients. That is really what would provide the most meaning to me in the work that I was doing. And then as I gained experience interacting with patients, I realized that I actually enjoyed interacting with patients as well. And like many physicians, it became a situation where I kind of liked everything. And that was reflected in the fact that I do see patients in the clinic, I run a research laboratory, I do clinical research, I try to do everything in a way that, again, ultimately ties back to the patient, because that is where I see the impact being the most important. So my interests in cancer date back to when I was in graduate school. So I did combined MD PhD training, and I was interested in the fundamental pathways that drive cancer. Following completion of my MD PhD degree, I then moved into internal medicine training and then hematology oncology fellowship training. Through the course of this training, I in particular became interested in blood cancers, then more specifically in myeloproliferative neoplasms. So these are diseases that, for me, scientifically, they're very fascinating because they are diseases where they're fundamentally they're characterized by overproduction of blood cells. And that's one of the basic definitions of cancer is overproduction, or cells growing out of control. And so I've been interested in what drives these processes to lead to the overproduction of blood cells, to try to understand what causes the particular problems that we see in these patients, and then to try to develop better therapies for these diseases. Not uncommonly, we have patients who live, say, a rural area and live multiple hours away, and they may have been somewhat reluctant to travel up here, and I completely understand that. But what I've found is that when they come here and we take the time to have a long discussion about what their disease is, what it means, in some cases they say, wow, I really didn't know any of that. I didn't know that there were other resources out there online or educational pamphlets that we make available to patients. And they find that even if it is a little bit of a distance, that travel for the visit was worthwhile. I also will say that I absolutely encourage patients to bring family members, patient advocates. I have absolutely no problem if patients want to have a family member on the phone or FaceTime them in during the appointment, or even record the visit, because that only adds value to the knowledge that's gained during that appointment. I've done it myself as a family member for that kind of thing, so I would be absolutely in favor of that if it helps the patient get more from their visit. Experiencing the medical system myself, through, like all of us do, for our own medical issues and dealing with family members or friends who have been ill, definitely opens your eyes and gives a different perspective. And I do try to remember that, the feeling of what it's like to be on the other side, so that I can, as best as possible, reassure patients and put them at ease during their visit. The future of this particular field that I'm focused on, myeloproliferative neoplasms, or MPNs, is really exciting, honestly. If you go back actually a decade ago, there was one single approved treatment for these diseases. So when I have a conversation with a patient, they ask me about what they should expect in that time span. I always tell them that I'm very optimistic, because we have new treatments that are available now, and we're gonna have even more in the near future. Now that I've been following some of these patients for so many years, we develop a very deep bond. Being a part of their care for that entire period I found to be extremely meaningful. In that sense, although I didn't necessarily expect or design it to be that way, this has been a really good choice for me in terms of my particular focus.